Good evening, friends. This is Dr. Kiran.
Dr. Kiran, I'm happy to meet you.
We have Dr. M.Kumaresan, who is a ENT surgeon with 48 years of experience. He is one of the pioneers in this field, and he has done an extensive lot of surgeries for the patients and trained hundreds of doctors in this field. He is a very dedicated person. He is from Chennai. He has his Siva ENT clinic at Triple Cane in Chennai. His son is also a ENT doctor. So we have a great opportunity to talk to Professor Dr. M. Kumaresan and learn about his life experiences, about his childhood, education, his medical field expertise, and then about a few questions about his personal life, etc. So, Dr. Kumaresan sir, thanks for accepting this invitation and participating in this diabetes talk. Our intention is to share about how to lead a happy, healthy life so that we can prevent lifestyle disorders like diabetes, hypertension, cholesterol, obesity, few other ailments. So, Dr. Kumaresan sir, how are you, sir?
Yes,
and how do you feel?
Happy.
How do you feel about this lockdown, COVID time?
Tell me whatever you want, I'll be able to answer on this good day. Okay,
Nice,
kindly tell. Okay,
so,
this is a great opportunity, I can say. Okay, I joined our medical education MBBS at Madurai Medical College 1966. So 1966 batch, we are in Madurai Medical College, and we had a great opportunity for education, social work, sports, and everything in Madurai Medical College. I was a university blue in volleyball and athletic when I was there in Madurai Medical College student. And that time also, I'm very much interested in social activities and cultural events. That is a very great thing for me, attracted the cultural events. When I was a student, MBBS student in Madurai Medical College, I used to write a lot of stories, dramas, and I acted in that also. Then I pursued my diploma education in Madurai Medical College. Then I joined in government service as a diploma student, and immediately I was selected for MS ENT in Madras Medical College, and I continue my studies in Madras Medical College. And I was an assistant surgeon and then became professor of ENT in Stanley Medical College. Then I retired. Now I'm having my own hospital. Here also my main work is research only. Kiran, you are a great diabetologist in Hyderabad. You had educated in Madras. I still remember you are shaped by the greatest diabetologists in Chennai. They are very popular in the world. Why they become popular mean they have the statistics. That is the main thing. And everybody in ENT or diabetic or BP or hypertension, India is having a lot of cases, but statistic is lacking. But you are the person very much interested in collecting statistics from your beginning of your life. You are very much interested, collect the cases and find out what are the problem, basic problem that had lifted you to a great extent as a diabetologist in Hyderabad. And I pray God, you should have many more laurels to come. Okay. Thank you, brother. Tell me whatever.
Thanks for sharing your great experience, sir. Can I ask you in which year you were born, sir?
1943.
So before
I
independence.
had my schooling at Kanyakumari district at the Sushindram High School. See, there itself my research work started. You may be surprised to know what happened to this fellow. He had selected ENT main. There is a great temple called as Tanumaliya Swami Koil at Sushindram. There the beauty, music pillars are there. You know, Sarikama Padanisa, the pillar is there, which attracted me. And another very important thing in Sushindram Temple, Talumalaya Swami, great temple is, you'll have all the photos or writing or scriptures of Ramayana. In one of the statue, if you put a probe into the ear, it will come to the nose. So that is a fantastic experience I had. Whenever we go to the temple, we used to play with some kuchis. We'll try to put inside the ear. It will try to come to the nose. That attracted me.
So there was a
that
connectivity.
had a great fundamental. Okay, there is a connection between the ear and nose. That is the basic thing attracted me to go for ENT.
Nice, sir. Nice, sir. Nice, sir. Well said, sir. So you had gone through a lot of situations, various stages of life. So you were born before the independence, and you are seeing now the electronic and the media conquered world you are able to see. So how do you feel this transformation, sir? I know you have written so many books, and you are a very good specialist, especially for puberphonic patients. And within seconds to minutes, you have healed the problem which they had been suffering for years together, decades together. And with the first visit with you, after you diagnose the actual problem, even without any major investigations, with your touch, with your experience, you can just get them out of all the trouble in their life. And within seconds, like a magic, you were able to heal them, sir. So can you just share some experiences of that?
Sir, beginning of my career, I am very much interested in research work. See, that time the famous thing is we used to have a lot of bleeding from the nose that caused by rhinosporiosis. For that, I have written 3 articles in international journals, rhinosporiosis. Then what happened is, I was taking classes for the student in Stanley Medical College as a professor and examiner and everything. Fortunately or unfortunately, after retirement, we have to retire from taking classes. But my intention is take classes. So I had the opportunity to teach nursing students and the BT students. That is a great opportunity I had in Triplicate, where I live in Chennai. So there is nearby my house, there is an institution for BT, Bachelor in Training for becoming teachers. That principal is well known to me. She asked me to take classes for BT teachers. My intention is ENT. So I used to take 20 years for all batches, how to protect your voice, how to improve your voice, how to care your voice. That had given me an inspiration that there is a section of people having puberphonia, voice talking in female tone, that can be corrected. I had many days of sleeplessness on seeing some of the patients of puberphonia. They are not cared. The parents, relatives, they are accustomed with that speech, like that. They are not bothered. They thought it will be all right. They will show to doctors. ENT doctors will refer to speech therapists. Definitely, good speech therapists are there to treat them. But what happened is, it will take a long time. They will do all the procedures. You speak with alphabet or consonants, speak with some object in the mouth, you do babbling, and all other types. But it will take long time. Then they have contemplated for surgery. See, from the beginning itself, we are taught voice is created by the vocal cord, so that there is a damage in the vocal cord, they say. But we have done 600 cases of puberphonia. All the patients, the vocal cord and structure of the tract, the respiratory tract, phonatory tract is completely normal. This is well accepted by all the ENT surgeons. There is no anatomical changes. There is no physiological changes. But what happened to them? It became a habit for them to continue their voice even after puberty. Everybody know puberty time, voice break. Until puberty, male or female, they are having the same tone of voice, just like a female only. So that we can tell clearly. If a boy of 10 years is singing in a cinema, the background music is given by a lady artist only. Okay? So after maturity, voice breaks. There are so many reasons we can say, but there is no anatomical reason for it. There is no hormone problem for it. But the world feel this may be due to a hormone problem. So it is not due to hormone. We have done analysis of hormones, male hormone, female hormone, which is completely normal. Dr. Kiran, here I want to emphasize this is a very big social problem. The boys will get dejected. They never want to face the interview. They will never want to mingle with the society. If a boy in a society is not mingling with the society, not marrying, not going for higher education, or not going for job or interview, the main problem may be a puberphonia that had hurt their feeling. So that is why now after my retirement for lifelong, I want to take this subject as the only subject for me, because many people don't know where to go, and the ENT surgeons are doing it, but they never want to expose to them, because they will do all the trial, go to the speech therapist, try, and then come. But if a puberphonia come to me, immediately I will measure their voice by an app we have created, because their frequency I can note by showing the app. You just read it in their cell phone. You know that ladies are having high pitch, male is having low pitch. So high pitch, if you are able to measure, we can tell them you are having puberphonia, high pitch voice. This we can make it as low pitch. Then what happened? They are having the confidence. Oh, this doctor found out what is the problem for me. So this is the thing, as a doctor, first we have to create a confidence. Sir, Kiran sir, I have visited your clinic few times. You are giving a great confidence to the patient. See, even today I am telling, confidence is the first treatment. It will increase their hormone, it will increase the energy for the patient. Even this age, I have seen your video. You are doing 1 hour yoga, meditation, and exercise. This, you may think this is you are doing for your body. No, 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 no. You are illustrating those who have seen the video. I started practicing your ideas, brother. How you are a diabetologist, so are you teaching all the things to the patient, or you are doing only for yourself, doctor?
Sir, motivated by many professors like you, you are one of my inspirers, sir. See, such a great experience with the age. First of all, I think a person should live a healthy, happy life. Unfortunately, nowadays we are witnessing many young doctors are getting into troubles, especially health troubles, sir. See, when oneself is in trouble, how are we able to heal others? Like, if a person wants to donate, he has to have something with him, at least little in excess, so that he can donate. So like that, we should be very healthy enough to share the health to the people. So our mind, our body are very important to distribute and share good health to the patients. So there are many things which I have secretly learned from your lifestyle and trying to implement
So,
it to the patients.
sir, I had a lot of opportunity for physical exercise. How it happened is, we are all University Blue in Madurai Medical College, because in our village, every village in Kanyakumari district, we used to have volleyball team, every village. And once in 3 months, we'll have some competition between one village and other village. So I'm having the opportunity to do volleyball regularly in Madurai Medical College. So this had given us a good specific. Along with that, we know that, see, we are all 6 feet people will be able to do long jump, high jump, and throw ball and everything. And there are inter-medical meets. When we had the medical college in that time, only 5 medical colleges were only in Chennai, Tamil Nadu. So we used to have competition between these 5 medical colleges. We used to become the champions, Madurai Medical College. Yes, some of the times we are limited by Stanley, and Vellore is having a very good team. So we are able to do a lot of work. Moreover, in my village, there are a lot of Vidwans, lot of native doctors, and they are called as Asan. My uncle is a Asan, my father's father. He used to treat, these are all native doctors. That time itself, the bleeding nose and the abscess, fever, back pain, everything. So that also attracted me. I'm now also very much interested in using some of our native medicine for me, and for I can advise the people go to the correct person to have the native treatment. There are good Siddha doctors in Chennai. I personally feel that is very important for the professionals like us to have some idea about the native treatment also. What about your feeling, brother?
Definitely. We are finding so many improvements. That is, some situations, some cases, we have to go back and find answers in the past. Even the diabetes, many people come with very high sugars, say 500, 600. My highest experience of having a patient was with 1280 blood sugars, HbA1c of 18, 19, even 20 HbA1c. So once we bring down the blood glucose to neutrality, by bringing the blood sugars down, we would have definitely gone up with our insulin doses. So then after the blood sugars come to not normal, to bring down the insulin doses, I have to make the patient more lifestyle modification strict, bring down his sedentary lifestyle, make him more active, make him cut down on the sugars, sweets, and then make him comfortable, confident, happy. By bringing this, the insulin units which have gone up by bringing down the blood sugars, now by bringing the blood sugars in the lower range, we have to slowly bring down the insulin units. So for bringing down the insulin units, we have to use some of the old traditional methods here.
You are correct. Similarly, we are going to the modern science also. See, even the puberphonia, for those who are having phobias, they will continue to have the phobia, I will get the voice or something like that. So we used to give even virtual reality treatment with the Oculus. That I have learned in Chicago and Los Angeles. The great neurosurgeons are there. So I was 5 years back, I was in search of neurosurgeon or neurophysician who were doing virtual reality treatment. Then I was searching, and gone to Los Angeles University. Who is doing the virtual reality treatment? I want to learn, because most of the my patient are having phobia. That is a big problem. They want to have a relief from phobia. So phobia, even in ENT, you know, most of the children are having problem with speech disorder or little problem in their physical development, delayed development. It can be made all right with, like autism and I think, all right with virtual reality. This is only in trial. You cannot say it is completely good. But in phobia, public phobia, speaking phobia, acting phobia, or face an interview, that phobia, we can make it all right immediately with virtual reality. Great. So I went to Los Angeles and see what happened to the great man, V.S. Ramachandran, who founded mirror box for phobias. You know, functional pain. In amputated limb, if you are having pain, we are not able to cure it. And the war victims who have come from war, they will have the phobia forever because they have seen the terrible events. Similarly, I had the opportunity to go there and meet him. He taught me the method of virtual reality treatment for, virtual reality treatment with mirror box. This is the greatest thing I had. With that experience, I went to Sri Lanka and did 4 medical camps for relieve the tension of the people post-war, post-traumatic stress disorder. And I had a lot of camps in Sri Lanka, in Hutton and Norelia and other people, the poor Tamil people are suffering. We had some camps with the help of the Minister Thondeman and other Tamil speaking associations. That also helped me a lot. And we did. Now my interest is this puberphonia, we are making it all right by no operation, no surgery, only by resonance manipulation. This is taught by me. We got, luckily, more reference I am getting from Tamil literature. More reference I am getting from Avayar. You may think Avayar has written many poems for children, advising. Many things from our Bharatiya. Bharatiya had written about virtual reality. Mayamo, Kanbadallam, Mayamo ennu koorinar. So similarly, Avayar told me, his literature, if you are reading, Chitramum Kaipalakkam Chendamilum Napalakkam. Sattatin Mulam Sadasivam Kandel, Chittatin Mulam Sivalingam Kandel. Then I have gone to the deep Tulhapyam, which is the ancient literature which told about the origin of speech. That's what I am following today. Munti Mudala, Munti Validondi, Talilum, Medetilum, Nenjilum, Nelith, Palidal Nakumukha, Annam Pada, and more. Even though today Bernoulli has brought the theory of voice production, neuromuscular and aerodynamic theories are accepted. The air has to come from abdomen. He got so many awards, Bernoulli, aerodynamic theory. So for speech, it should originate from abdomen. The air should come. That only create a vibration and resonance in the oral cavity. But 3,000 to 5,000 years back itself, Tolgapiyar told, Mundi Mudala, Mundi Validoti. That means the air should come from abdomen to create voice. So I had a lot of opportunity for me. I can say, as people in southern region of India, we had a lot of opportunity to read the olden literature, 3,000 to 5,000 years old literature now available with me that I have to present to the world. 4 international papers I have published in Puberphonia alone. I am just now utilizing this leave for writing articles.
Nice, sir.
3 articles I have finished in 3 weeks. I am in the home. Almost leave, everybody says, but every day I have to read 3 books. Yesterday I have seen, you will wonder, Moses had problem in voice. The great man, he heard the godly voice. How godly voice he got? Not by writing, but fire. God, he went to the mountain with where a lot of leaves are there. God appeared in light and written the testament. So how voice come? It is by light according to the Bible. Moses, he is telling, I am having problem with my mouth, my lips, tongue. I cannot be able to tell the people strongly as a orator. Give me the strength. I don't know what is the problem with Moses. I have to read the great man story. We have to read what is the problem. So similarly, if we are going on reading, we'll get lots of ideas. But Einstein's book I am going on reading, he says, more experiment is not required, more reading not required. You think, imagine, you will be able to create. Kanavu Kanangal, you want to do something, you think about that, you will get it. Abdul Kalam also suggested the same thing only. So great, sir.
Sir, when you said about Abdul Kalam, sir, you both are coming from the same area, sir. Was there any coincidences, sir, with Abdul Kalam, sir? Was there any?
Yes.
Was there any coincidences with Dr. Abdul Kalam, sir, for you, since you are also from the Kanyakumari and Madurai?
Yes. He's a great man. Say, we used to tell lots of good people are there in this nation. One of the greatest man in our time we have seen, we met, we talked. He's a great man, selfless man, scientific man, more knowledgeable man. He's writing books, very great thing. You have to read it. It will bring light to our life. Doctors, anybody can read that. So such a great man had a simple life and achieved the greatness. That's what I can say.
Sir, do you see a photo, sir, with you?
Yes, Karan, what more we can have the sharing. It seems some of the photos, this is, I'm with a famous cinema producer, Mr. Venkatesan. He had produced more than 20 cinemas, more with Kamal Hassan and other thing. And so this is he is a good friend of mine.
Oh.
We had lots of experience with him. Then,
this photo, sir?
Next, yes, this is Kabi Kamu Sharif. He had written lots of cinema songs for MGR. Valdalam Yesum, Taldalam Yesum, Mayaham Iddanada, and so many other things. And he was a freedom fighter. He is the instrumental for making Tamil Manilam as a bigger one even after the independence.
Nice.
I had a more opportunity with him. This is the great man. The madam standing in the right is Dr. Professor D.R.M.Kumaresan. was a vice chancellor of our Tamil Nadu first university, and second man is Dr. Kumaresan, and the other was a great professor from Chandigarh. He was my teacher, and he taught me even the smallest step, including how to go into the brain through the nose. That is the endoscope. He taught me so many 30 years back. He taught me.
Sir, something about your family,
And,
sir.
this is my humble family. My wife, my son, he's a ENT surgeon working as professor of, he's in ENT.
Dr.
He's
Naveen.
not professor, he's just entered into the ENT department in
He will become a
Samhita
professor,
Medical
sir.
College, Chennai. My daughter, she's a pediatrician working as a pediatric doctor in America.
Nice, sir. So your both children are doctors, sir. You have contributed
Yes,
great things
my
to the
son and
society.
daughters are doctors.
You had
So,
always been a voracious speaker.
small photo of mine, and my work is more accepted and agreed by the ENT community of Chennai and India. They have honored me with a lifetime achievement. We have visited more than almost all countries, and this is one of the things I had frequent visit to Thailand, because you know that Puberphonia was more in Thailand. So I had the opportunity to go, and little more thing I have to do in Thailand and Indonesia and other places where the Puberphonia is more. I should go there and do my work in some of the foreign countries.
Sir, let's pray to God
And
after this COVID lockdown season ends.
Puberphonia.
After this COVID season ends, definitely we will all be coming out, and we'll take great opportunities to explore more from this world. Sir, thank you, sir. You have given a very nice elaborative about the past, but simple words about how you maintain your good health even at this age, sir. How many years old are you now, sir?
Do exercise regularly, live happily, don't worry about what is happening in your life, what has happened, but aim for a great thing, we will get it. That's what my spirit of love. Live with the society, accept everything. Everything is for our good health only. God is great.
Sir, it's been more than 10 years since we almost met personally. So thanks to this lockdown season, we were able to make this conference possible. And thanks for sharing all your experiences, sir. We will stay in touch. I pray God to give you good health. And as usual, be happy and healthy, sir. Nice, sir. I will end this session with this, sir.
Thank you.